Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform. Today's topic of choice, we're going to talk about some amazing rapid revision stuff. Is my voice audible to everyone? Please put a message in comment section. Thank you. Hello everyone. Today we're going to talk about some amazing topics of growth and development, and many of the juniors they were requesting for the short stature topic. Short stature is one of the important topic for the exam purpose, so we're going to talk about that. First of all, is my voice coming to everyone? Please put a message in comment section. Thank you so much. Hello, so many people are there. My name is Dr. Anand. I'm MD Pediatrics, and yes, this is the beautiful Unacademy NEET PG platform. First of all, we have this this is the month of March and last week is there, so I want you guys to give as many tests as possible, give as many MCQs, as many tests. I have started this midnight test series and early morning test series. I hope you guys are a part of it. Lot of tests, lot of tests, lot of tests. Give as many tests as possible. That is the first point. Second, most importantly, we are launching this previous year question bank. We have this amazing previous year question bank batch where I have covered the last 5 years, INIC, INICET, PGI, AIMS, NIMHANS, JIPMER, and NEET PG rapid revision questions. If you're a newcomer, please watch the previous videos. Hello, so many people have come. Hi Priya, hi Nishi, hi Anshika, hi Swaraj, Vaidehi, Osama. मैंने शेव करा ली, देखो ओसामा. ठीक है, सावन ठीक है, अभी खुश, सारे खुश हो गए अभी. ठीक है. Yes, so beautifully we have this in the Unacademy platform. We have amazing something known as Unacademy Lite. So only 2 months left, only 2 months left, and we have this a very light pack for 2 months where we have this 450 practice test papers. If you give, it'll be nice, known as Unacademy Lite. Okay. This is the end of the year sale, guys. March 28th to March 31st. Today is the last day, March 31st. We have this amazing 20% off. This is the duration for 2 months pack, 6 months pack, 9 months pack. We have the old price and we have the final sale price, and old iconic price and the final sale price. All you have to do, if you want to take any pack for 2 months also, if you want to take the pack and they use the code Dr. Anand, it will be easy for you. All the faculties, every lecture you will get nicely. Also, we are launching this MBBS Prof 1. Like today only I was taking a class for final year MBBS students. It was a very nice class. They all loved it very nicely. And we are launching this MBBS first year batch, which is important if you're preparing for next exam. Also, doubt clarification series. Many of the students have doubts, like they have done a lot of revision, but they have still here and there doubts. So most importantly, with the top educators, we have this doubt clarification series. If you have any doubt, you can post it in this segment. Okay, that's it. In the Unacademy, we have something known as plus subscription, where amazing access we have to the live and recorded classes. The faculties are really good, the content is very nice. This is the plus subscription. Whereas in the iconic subscription, you get the Unacademy platform and the prep ladder subscription. All the beautiful clinical notes, video lectures, question bank, everything you get on the iconic subscription. This is important, this is nice. Hello Nishi Agarwal, hi Ashwarya. Pani de na please. Hello, Dr. Ali Zulfikar. Hello, Akhilesh. Hello, Ashwarya. Hello, Nishi, Swaraj, Anshika, and Savan Singh. Very good. So, congratulations to the amazing FMG toppers. People who work hard deserve to be on this podium. And now it's your turn for the next NEET PG and FMG exam. I want you all to rock it. Okay, that's it. And we all know that if you're new to Unacademy, download the Unacademy app. We have some special class features where you never miss the classes because all the lectures are recorded and you get the PDF notes. So this is a special class. So if you're new to Unacademy, download Unacademy. Okay, that's it. The batches we have already made is the NEET PG 2022 high yield theory revision batch, and for FMG students we have the FMG 2022 batch, which is going super hit. That's it. So let's start the amazing class. This every day till our NEET PG exam, only 1 or 2 months left, hardly any time is left. I am putting lot of tests. I have started this rapid revision neonatology every day. Some or the other system we are doing. We are doing lot of contests. We are doing lot of prizes also we're distributing so that you guys get little confidence. So let's do it every day till our NEET PG exam gets over. Okay. So before starting any beautiful segment, we always have a motivating quote. And today's amazing motivating quote is what? Today's quote is, do what is right. Do what is right, not what is easy. Do you agree with this? Yes or no? Do what is right, not what is easy. What is easy? Sitting in the house and watching Netflix. What is easy? put on weight and eating momos as much as possible. This is very easy. But what is right? Not eating momos, not become like Savan Singh, who is 126 kg. Okay, Savan, what is your weight? और सावन पतला सूखा सा है, but सावन बहुत मोटा है. So do what is right. Do what is right, not what is easy. Okay. Let's start the beautiful class. Be the today's topic of choice is nothing but short stature. So most importantly, yes. So short stature. How do you define short stature? Like, which is the first PG question. How do you define short stature? Is I am a doctor. My baby's height is very short. Is very chota hai mera baby. So what is the what you call definition of short stature? Short stature is defined as, who will tell me, height less than which percentile? Third percentile, second percentile, fourth percentile, or fifth percentile? Very good. Dr. Happiness, Dr. Giri, Savan Singh, amazing. Height less than third centile. So height less than third centile. Let's discuss about this topic in a very beautiful way. Let's cover it off as much as possible. As much as possible. Okay. Perfect. Yes. So this class will be exactly for 30 minutes. Okay. Short stature. Short stature is defined as height less than third centile. Number one. Number two, do we have any short stature is defined as height less than third centile? What about microcephaly and macrocephaly? Do you remember? Can anyone tell me? Microcephaly is defined as head circumference less than how many standard deviation? Yes. Microcephaly is very importantly, microcephaly is head circumference less than minus 3 standard deviation. Macrocephaly is head circumference more than 2 standard deviation, that is macrocephaly. So microcephaly is head circumference less than minus 3 standard deviation. Macrocephaly is head circumference more than 2 standard deviation. Short stature is defined as height less than third centile. And if I want to talk about in standard deviation, this was the super specialty question. I recently gave NEET SS, उसमें ये क्वेश्चन आया था और उसमें मैं गलत करके आया था. तो short stature is defined as height less than third centile. And if I want to talk about the standard deviation, it is less than minus 2 standard deviation. It is less than minus 2 standard deviation. Has everyone understood this much, dear? Dil se padhna, good vibes, only and only good vibes I want. My health is getting much better now. My health, my face, everything looks much better. So yes, so good vibes. So 4 questions over. What is microcephaly? Head circumference less than minus 3 standard deviation. What is macrocephaly? Head circumference more than 2 standard deviation. What is short stature? Height less than third centile. Or if I talk about minus standard deviation, it is less than minus 2 standard deviation. That's it. Dr. Happiness is saying, sir, if we watch 9 sessions of Mission May, which you took in February, will it be enough for pizza? For the rapid revision, yes, dear. For the rapid revision, Dr. Happiness, it will be nice. And there are still more videos to cover. Chalega, if you watch my rapid revision of this Mission May revision videos, you start just watching them, it will be really helpful for you. That's it. Yeah. Can anyone, Nishi Agarwal, my daughter is short. Dr. Nishi, could you please tell me what is the cause of short stature in my daughter? What are the various types of short stature? Anyone? Dr. Nishi, Aishwarya? Yes, what are the various types of short stature? Have you heard of physiological short stature and have you heard of pathological short stature? Yes, yes or no? Dr. Happiness, yes. Good vibes. For next 30 minutes, I only and only want good vibes in every class. And guys, in the month of March, we are changing the timings also for our classes. I no longer be teaching from 5:15 to 6:15. I will be joining gym at this time and late evening after 6 o'clock, maybe 7 to 8 batch. Let me know in the comment section which timings you guys are comfortable for me taking the class in the next month. The option I'm going to give you is 7 to 8 batch I have, or we can have a small quick class 8:30 to 9 o'clock. We can have a class, or we can have a class later like 10:45 to 11:15. Which segment of the class is easy for you? Let me know. So yes, doctor, my daughter is short. Okay, my daughter is short. What are the various causes of short stature? Number one, physiological and pathological. Number two, in physiological, my dad is short, so I am short. Yes or no? What are the various causes of short stature? Number one, if the parents are short, then the baby also can be short. Yes or no? Yes, that is the first time. Number one. So yeah, so one is physiological short stature, one is pathological short stature. In physiological short stature, it is the parents are short, the baby is short. That is physiological short stature. And in pathological, so if for knowing the short, you need to know the upper segment, lower segment ratio. Yes or no? For knowing the short stature, whether it is physiological or pathological, one thing you have to do is nothing but the upper segment, lower segment ratio. So what is the upper segment, lower segment ratio? Anyone? Ayushi Gupta. Gupta, Anshika, yes, we have to talk about the timings, okay? Because tomorrow is the 1st March. I'm gonna take a 1 day halt. From day after tomorrow, I'm gonna start teaching again. That's why. So yes, so upper segment lower segment ratio at birth will be 1 point. Who will tell me what is the normal upper segment lower segment ratio at birth? Very good. The normal upper segment lower segment ratio at birth is 1.7 is to 1. Yes, exactly. At 3 year of life is 1.3 is to 1, and 7 year of life, 7 year of life, it is 1 is to 1. Very importantly, PG questions, okay? The normal upper segment lower segment ratio at birth is nothing but 1.7 is to 1. At 3 year of life, upper segment lower segment ratio at 3 year of life is 1.3 is to 1, and 7 year onwards it is 1 is to 1. Right, it is 1 is to 1. Perfect. Right now, most importantly, yes, what extra points I need to understand is this only. Yes, as I told you, there are various types of short stature. One is physiological short stature and one is pathological short stature. In physiological short stature, like the remember always we have physiological short stature and pathological short stature. In pathological short stature, it is divided into proportionate short stature and disproportionate short stature. Very, very, very important. Yes. So Pankaj says, sir, are you planning to teach all peds from starting again in future? Yes, dear, of course. Once we finish this mission May revision, no, this NEET PG exam is just around the corner. 1.5 month left, and the PG exam is there. So after we finish that, we're gonna start everything from a page 1 chapter 1.1 line 1. We're gonna start again properly. But abhi last 1 month we have to revise and revise, right? Perfect. Yes, my dear Osama Sheikh is very right. There are two types of short stature. We have proportionate short stature and we have disproportionate short stature. And remember, in the disproportionate short stature, it is divided into something known as short trunk dwarfism and short limb dwarfism. I'll repeat again. Listen very carefully. There, what? How many types of short stature we know? Two types. What are those? Physiological and pathological. Physiological and pathological. In the pathological, it is divided into proportionate and disproportionate. In the pathological short stature, it is divided into proportionate short stature and disproportionate short stature. In the proportionate short stature, the baby will be short. There is short stature. In the proportionate short stature, the upper segment lower segment ratio will be normal. Now this is a very important part, my dear friends. Yes, buddy Asavan, you're very right. In the proportionate short stature, the upper segment lower segment ratio is normal, is yes normal, whereas disproportionate, yes, in the disproportionate short stature, we have something known as short trunk dwarfism. What happens in short trunk dwarfism? Will the upper segment, lower segment ratio will increase or decrease? So short trunk. Trunk matlab upper segment. No, upper segment is there. No, the trunk is formed by the upper segment. So short trunk means upper segment will decrease, nothing but decrease upper segment, lower segment ratio. Yes, very true, Nishi Agarwal, very true. And what happens in short limb dwarfism? See, one is short trunk and one is short limb. In the short limb dwarfism, the upper segment increases, so upper segment lower segment ratio also increases. Very, very important. This is something very important we must understand. Okay, so very good. I'll repeat again. What is short stature? Short stature is defined as height less than third centile. What are the various types of short stature? We have physiological short stature and pathological short stature. In physiological short stature, if my mom and dad are short, so I am short. That is physiological. And what is pathological short stature? In the pathological short stature, it depends. It is proportionate short stature or disproportionate short stature. In the proportionate short stature, the baby will be chota, but the upper segment lower segment ratio will be normal. Whereas in disproportionate short stature is divided into short trunk and short limb. In the short trunk there is decrease upper segment lower segment ratio, and in short limb there is increase upper segment lower segment ratio. Now very importantly, yes, now PG entrance question number 1. Can anyone please tell me which is the most commonest cause? Which is the most commonest cause of proportionate short stature? See, one was disproportionate, okay, where it was short trunk and short limb. Proportionate short stature, which is the most commonest cause of proportionate short stature? Osama? Hmm. Yes, very good. So Nishi Agarwal is very, very right. The most commonest cause of proportionate short stature is nothing but constitutional delay, not something known as CDGP. something known as CDGP. What is CDGP? Constitutional delay in growth and puberty. Constitutional delay in growth and puberty, basically it is the most commonest cause. It is the most commonest cause of what you call the proportionate short stature. Okay, so yaad rahega nahi rahega, every single word is important. Okay, good vibes, I want only good vibrations. Okay, so what are the causes of proportionate short stature? We have familial short stature, we have constitutional short stature. Which is the most commonest cause? Constitutional short stature is the most commonest cause. Now, very important, they ask in exams that what happens to the height? Well, what is the difference? Can anyone please mention what is the difference between familial short stature and constitutional short stature? Anyone? Osama would like to answer anything? Exactly. Remember one thing, in the constitutional, there are two types of short stature. Okay, familial short stature and constitutional short stature. दोनों बच्चे छोटे हैं. One is familial, one is constitutional. Always remember that in the constitutional short stature, the final height is, what happens to the final height? The final height is normal. The final height, if this is the graph, if this is the normal thing, in the constitutional short stature, the baby will be normal, 2.5 kg baby, normal baby. By the 1 year of life, he will dip. By the 1 year of life, he will have short stature. He will run parallelly from 1 year of life till 12 to 13 year of life. He will run parallelly below the graph of the normal centile. But by the end, the final height, the baby will come up again. So can we appreciate this very important point, that in constitutional short stature, the final height will be normal. Whereas if I draw a diagram of the familial short stature, this is also now another familial short stature. So what happens in familial short stature? This is the normal graph. The baby born again this point, which is normal vaginal delivery, normal baby, everything was fine. By the 1 year of life, again the baby got dip in the height. The baby got a short stature. Same like this. Okay, by the 1 year of life, the baby's height percentile fell down below the third centile, which is known as short stature. Again, by 11 to 13 years of life, like 1 year, 2 year, 3 year, 4 year, by 11 to 13 year of life, the baby's graph is below only the normal. The baby is having short stature, but the final height also will be low. The final height also will be short, very important. And whereas the final height in constitutional delay will not be short. Has everyone understood this much? Yes or no? So we have Neil, he's asking, hi boss, how are you? I'm good buddy, how are you? आप कैसे हो? क्या चल रहा है? ठीक है? Yes. Now, what are the other important causes of short stature? One, I understood, I'm not eating well, familial cause, constitutional cause, right? The other important intrauterine causes are IUGR or small for gestational age baby. Let's revise back to back. Dr. Osama, आगे आ जाओ, आगे. और अगर जवाब नहीं दिया बेटा, घर पे आके मारूंगा मैं. तो what do you think? So Rashmi, yes, what is small for gestational age? What is the definition of small for gestational age? So Neil says, I'm doing great. Thank you. That's great, bro. Thank you for asking, Neil. Keep coming to our classes and keep joining them. It will be beneficial for you. Yes, what is small for gestational age? Swaraj, what is the definition? What is the definition of small for gestational age? Who will tell me? Anyone? What do you think? Dr. Osama, what do you think? Hmm. सो वॉट लेस देन 10 सेंटाइल? ये तो ऑस्कर भी इतना तो ऑस्कर भी बता देगा, लेस देन 10 सेंटाइल क्या? वेट फॉर हाइट, हाइट फॉर एज, वेट फॉर एज, height for age. I have given you four options. Yeah, I understood that you are saying there is something known as 10th centile and something known as 90th centile. यहाँ पे क्या होगा, यहाँ पे क्या होगा? Is it height for age? So okay, I'm really happy that Osama told. So remember, it's not wait for height, dear. It is wait for age. That's what I was asking you. Wait for age. Wait for age. This side is 1 kg, 1.5 kg, 2 kg, 2.5 kg, and this side is the age, 35 weeker, 36 weeker, 37 weeker. If the baby is 2.5 kg, 2.5 straight line I draw like this. If the baby is a term baby, so see this. Can you see that? Wait for age. Osama, इधर आ जा, तू आगे आ जा, आ गया, तू आ गया. गलत कैसे बोला तुमने? तू आगे आ जा, तेरे को आज ऑडियो क्लास है, 9:30 PM ऑडियो क्लास है, सुनाएंगे अच्छे से। आज तुम 2 गाने सुनाओगे। ओसामा विल सिंग 2 सॉन्ग्स, जो जो गलतियां करेगा वो गाने सुनाएगा ऑडियो क्लास में। एग्जैक्टली हाँ, ओसामा इज लाइक सर, और हमेशा हमेशा कंफ्यूज हो जाता है। कंफ्यूज कैसे कंफ्यूज हो जाता तुम? नहीं, कंफ्यूज नहीं होना, कंफ्यूज डिक्शनरी में नहीं है। वेट फॉर एज, तभी मैं बार बार पूछा, तब दैट्स व्हाई आई एम आस्किंग अगेन 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 अगेन। Yes, so wait for age less than 10 centile is small for gestational age. Wait for age between 10 between 10th and 90th centile is appropriate for gestational age, and wait for age more than 90th centile is large for gestational age, right? Exactly. वेरी गुड रश्मि, वेरी गुड रश्मि। रश्मि बहुत अच्छा गाना सुनाते हो आप क्लासेस में, आज भी सुनाएंगे 9:30 PM, ठीक है? वेरी गुड। हाँ अच्छा, एक और आया हीरो डॉक्टर सावन। तू तो आगे आ जा। क्या है? एस जी हैज़ एज सो वेट फॉर एज। हाँ ठीक है, यस, एस जी में एज होता है ना, एस जी एज, रिमेंबर एज, ठीक है? और सामा देखो अच्छा सा बताया सावन ने, एस जी है ना, एज एज, वेट फॉर एज, रिमेंबर दैट, राइट? दैट यू शुड नो। परफेक्ट। तो ओके, नेक्स्ट इंपॉर्टेंट पॉइंट, द अदर कॉजेज ऑफ शॉर्ट स्ट्रेचर। सो कितना हमने क्या क्या पढ़ा अब तक? नंबर 1, शॉर्ट स्ट्रेचर इज डिफाइंड एज हाइट लेस देन थर्ड सेंटाइल, और हाइट लेस देन कितने स्टैंडर्ड डिविएशन? -2 स्टैंडर्ड डिविएशन। व्हाट आर द वेरियस टाइप्स ऑफ शॉर्ट स्ट्रेचर? फिजियोलॉजिकल, पैथोलॉजिकल। इन पैथोलॉजिकल what all types are there? Proportionate, disproportionate. In disproportionate what all types are there? Short trunk and short limb, ठीक है? That all we have done, exactly, ठीक है? Yes, exactly, very good. And the other causes of short stature are IUGR, SGA, torch infection, genetic, and STD. Nothing but sickle syndrome, Turner syndrome, and Down syndrome, that you should know. Okay, very true. And here also one more thing. Torch. In torch we have toxoplasmosis, right? Dr. Osama, आगे आजा। तू बेटा नीट तक तो तू तो गया मेरे काम से, तो पहले बता रहा हूँ, जो बंदा मेरे मुंह पे चढ़ जाए ना, बस फिर तो हो गया। डॉक्टर ओसामा, प्लीज कुड यू प्लीज टेल अस द ट्रायड ऑफ कंजेनाइटल टॉक्सोप्लाज्मोसिस। टॉर्च याद है आपको? टॉर्च याद है किसी को? यस, डॉक्टर ओसामा आ गया ही जरा। व्हाट इज द ट्रायड? व्हाट इज द ट्रायड ऑफ कंजेनाइटल टॉक्सोप्लाज्मोसिस? एग्जाम इज जस्ट अराउंड द कॉर्नर, एवरी सिंगल वर्ड शुड बी ऑन द टिप्स। यूं होना चाहिए सर, कुछ भी पूछ लो सर, कुछ भी पूछ लो, सब आता है, कुछ भी पूछ लो। Yes, number 1, chorioretinitis. Number 2, intracranial diffuse calcification. Chorioretinitis, intracranial diffuse calcification, and what else? And hydrocephalus. नहीं dear, निशी अग्रवाल, I'm really happy dear you're trying, but microcephaly नहीं, macrocephaly होता है, बच्चे को hydrocephalus होगा, remember that, okay? Yes. So chorioretinitis, hydrocephalus, and intracranial diffuse calcification are the triad of congenital toxoplasmosis without fail. Without fail is a very important question in the torch infection. Yeah, that's very true. True. अच्छा ठीक है. अच्छा, and one more thing also. अच्छा, my wife has gone. अच्छा, गोलगप्पे खाने का बड़ा मन कर रहा है. Okay, next question. Very nice question. What are the acquired causes? What are the acquired causes of short stature? Anyone? What are the acquired? The baby was perfectly fine and then the baby got a short stature. Can anyone tell me? Acquired. Acquired. If I ask you the acquired causes of microcephaly, acquired microcephaly किसमें होती है? Anyone? Acquired microcephaly? Osama? Very good. So acquired microcephaly, it is seen in Rett syndrome. Very important. Acquired microcephaly, it is seen in Rett syndrome. Rett syndrome has which gene mutation? Osama, Nishi, Rids, Rashmi, Swaraj, and Osama. Exactly. Yeah. So acquired microcephaly will be in the Rett syndrome. The gene mutation is MECP2. MECP2 gene mutation. कौन बताएगा? किसने सही आंसर दिया? सावन सिंह, ठीक है। So the acquired microcephaly is seen in Rett syndrome. Rett syndrome, the gene mutation is MECP2 gene mutation. Very true. And the acquired causes of short stature are, of course, malnutrition. The baby was perfectly fine, then he stopped eating and he became malnourished. And very importantly, growth hormone deficiency also. That's another important question. See, the most important cause of, in general, of short stature, proportionate short stature, is that one, CDGP. But acquired cause will be growth hormone deficiency. Exactly. Acquired cause will be growth hormone deficiency. That's very true. And Osama is right. Rett syndrome, the one with acquired microcephaly, the one with MECP2 gene mutation, it is common in girls. And Rett syndrome is common in girls. And what are the other points of Rett syndrome? Rett syndrome, hand wringing, yes or no? We have done a beautiful video on that, right? Hand, the girl is doing like this, okay? Hand wringing like that, okay? Hand wringing movements. Very true, Sama. Perfect, perfecto. That's it. Perfect. So this is a very, very, very important picture, my dear friends. See, this one is the familial short stature. दो ही आपको याद रखने हैं. One is constitutional and one is familial. In which type of short stature the final height will be normal or the target height will be normal? Can we appreciate in this picture? See this one, this one. In the constitutional short stature, if you can see this, the target height is normal. Whereas in familial short stature, yes, the target height is not normal. In the familial, the target height is not normal. Yes, exactly. Yes, buddy Osama, very good. आपके मुंह में घी शक्कर, very good. अभी ठीक है, शेप शूप करा के चेहरा ठीक लग रहा है ना मेरा. शुड आई कीप बियर्ड? डॉक्टर सावन वाज टेलिंग, अब मैं उसको ब्राइब करूंगा बार बार कि आपकी दाढ़ी ना काटे करके. कटवाली दाढ़ी मैंने, जो करना है कर, करवाली कटवाली दाढ़ी मैंने, ठीक है. आई थिंक, व्हाट डू यू थिंक गाइस, क्लीन शेव इज बेटर और विद बियर्ड इज बेटर? I think I look better with clean shave, but I don't know. Some people, some girls specifically, they like dadi. Exactly. Yeah. And very importantly, guys, did I mention that in familial short stature and in constitutional short stature, the baby will be perfectly fine? The birth weight. बार बार मैंने graph बनाया था. Do you remember? Yes or no, dear? I told you this is the graph. The birth weight of the baby is normal, and then there is a dip. Yes or no? Exactly. So in familial and constitutional, the birth weight is normal. The birth weight and birth length is normal. That you should know. But remember, of course, everyone knows like the target height is over. And one more thing also, the timing of puberty in the constitutional short stature, the timing of the puberty is delayed. In constitutional short stature, the timing of the puberty is delayed. The timing of the puberty is delayed. Exactly. Perfect. Can we appreciate a very beautiful picture? Can we appreciate the final height basically is coming back to normal? The final height is perfectly normal in this case. Remember the final height in constitutional. Remember that this part is over. And which is the most commonest cause of short stature? Constitutional is the most commonest cause of short stature. Is the weight and height are normal at birth? Undoubtedly, yes. The weight and height are normal at birth. But what happens by the end of the infancy? By the end of the infancy, it becomes down. The height becomes down. Then it remains it parallel the normal. Normal से parallel रहता है, नीचे ही रहता है, but normal से parallel 6 से 11 साल तक उसकी height चलती रहेगी. फिर क्या होगा? But accelerate towards the end of the adolescent. Accelerate towards the end of the adolescent. And Dr. Othama, what is early, middle and late adolescent period? Tell me fast, very fast. एक सेकंड में आंसर आना चाहिए मेरे पास, और नहीं आया तो देखो तुम्हारा क्या करना मैंने. What is early, middle and late adolescent period? Very good. Perfect. So early adolescent period has already been a NEET PG question, so it's our duty to revise that question again. So early adolescent period is 10 to 13 years of life, 14 to 16 is middle adolescent period, and 17 to 20 is late adolescent period. Late adolescent period, that you should know. Perfect. Okay, this part is over. Yes. Yes, now coming to disproportionate short stature. Everyone knows about it. Disproportionate short stature is divided into short trunk dwarfism and it is divided into short limb dwarfism, right? The एक तो हो गया proportionate short stature where the upper segment lower segment ratio will be normal. One is disproportionate short stature where either the patient can have a short trunk or the patient can have a short limb dwarfism. So everyone knows the example exactly. The way जो भी whatever the spinal pathologies will be there, the baby will have a short trunk. Spinal pathologies as in, most importantly, can you think of kyphoscoliosis? Yes. What are the example? Anyone? Kyphoscoliosis? Yes. Spondylitis? Yes. TB spine? Yes. Butterfly shape vertebra? Yes, that's very true. And what else? And spondyloepiphyseal dysplasias. Spondyloepiphyseal dysplasias. Yes or no? Am I saying right? Is this line right or wrong? Spondyloepiphyseal dysplasias. तो ये हम क्या पढ़ रहे हैं? Sir, you are teaching something short trunk dwarfism. One is short trunk, one is short limb. In the short trunk, the examples are any spinal problem like kyphosis, scoliosis, TB spine, spondyloepiphyseal dysplasias, butterfly shaped vertebra, Alagille syndrome, which is the most common congenital heart disease, which is the most common congenital heart in Alagille syndrome. Anyone? The most common congenital heart in Alagille syndrome is pulmonary stenosis. The most common congenital heart in Alagille syndrome is pulmonary stenosis. What kind of vertebra do you see in pulmonary stenosis? Butterfly shaped vertebra. Very true. That's right. Very acha. Is everyone understanding, dear? Yes or no? Okay. Is my speed fine or should I reduce my speed? If I should speed in my speed should be slow, then please let me know. I'll make it slow. If the speed is fine, let me know. जैसे 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 मेरी तबीयत ठीक हो रही है, मेरी स्पीड ऑटोमेटिकली बढ़ती जा रही है. Perfect. And which is the gene mutation? In the test, basically, I took a test here. What is the gene mutation? What is the gene mutation we have in Alagille syndrome? कोई बता सकता है? Nishi Agarwal says speed is fine. Doc says speed is fine. Perfect. Okay. Which is the this one? We have Alagille syndrome is how many types? Shivam Singh Chauhan. Remember, dear, Alagille syndrome is type 1 and type 2. Type 1 and type 2. So in type 1, what is the gene mutation? Exactly. In the type 1 we have JAG1. In the type 1 we have JAG1 gene mutation, and in type 2 we have Notch2 gene mutation. How will I remember, sir? Exactly 1 1. Type 1 JAG1 1 1. Type 2 Notch2. Type 2 Notch2. So type 1 Alagille syndrome with the gene mutation is JAG1. The type 2 Alagille syndrome gene mutation is Notch2. The most common congenital heart in Alagille syndrome is peripheral pulmonary stenosis. Peripheral pulmonary stenosis. Monimula Naskar says audio session कहाँ होता है? On the Unacademy app. Like on the Unacademy app, basically today at 9:30 p.m. I have a audio podcast, audio session or a open house session. There is one, but it is only for the Android users. It is only for the Android users. Once you open your Android phone, there will be option of open house. Click on that and my face will come. That's it. Exactly. Yes. Acha, it's free for, yes dear, yes, Shivam Singh Chauhan is totally free for every single person watching Unacademy, free of cost. It's totally free, totally free. So anyone can join. कल भी कम से कम 50-60 लोगों ने join किया था. It was amazing. Today also we have at 9:30 p.m. Today is the last class, like in a way, because tomorrow I am on a break day, like 1 or 2 days. I want to relax myself. We'll go for a movie. How's that movie? Has anyone seen RRR? How's that movie? और एक और movie भी someone was saying some KGF 1 and KGF 2. Is anyone says this exactly? Shivam Singh Chauhan says it says you are not eligible, but आएगा, it will be there, dear, don't worry. Rebnex is saying today's topic. Today, I would like to ask you a question, little bit on cardiology and little bit on parabdomen. Cardiology and parabdomen, I will be asking you questions there. Okay, yes, exactly. Okay, Rashmi says, sir, लेकिन बार बार आपकी आवाज़ बंद हो जाती है. Actually, the problem is, Rashmi, like I am overworking. That is the problem. I am overworking. I'm teaching to so many platforms, so many students, like on my hospital also. Today also I had an MBBS class for final year students in my hospital itself. एग्जैक्टली FMG का नेक्स्ट सेशन जल्दी करेंगे, अगले हफ्ते करेंगे FMG का नेक्स्ट सेशन. ओके, डन. यस, ओपन हाउस में तो आज रात को हम बातें करेंगे. एंड KGF हाउस, KGF, आई डोंट नो, KGF इज नाइस. हैज एनीवन सीन KGF? एंड या ओके, परफेक्टली फाइन, ग्रेट. आगे बढ़ते हैं. सो JAG1 जीन म्यूटेशन, JAG1 जीन म्यूटेशन यू सी इन टाइप 1 Alagille syndrome. Notch2 जीन म्यूटेशन यू विल सी इन कहाँ क्या टाइप 2 Alagille syndrome. अच्छा, one question very importantly. Yes, exactly. This one. Okay. Ayushi says high time that Tollywood is rocking. That's great. That's nice, dear. And this one. Yeah, exactly. Dhananjay Sharma says, please, sir, and you really deserve a big break. Never seen such a hardworking person. Yeah, I must take a break. That's what my doctor was telling, because I am overly using my aura, my energy, and everything. That's why मेरी आवाज़ बहुत जल्दी ख़राब हो जाती है. So, आवाज़ के ही पैसे मिलते हैं, आवाज़ की ही बातें हैं. इतना जान है तो जहान है. So that's why I'm drinking lot of water. Every time I'm having a water bottle, my doctor has told take water every time. to avoid this post nasal drip and dryness of the throat. Exactly. KGF, हाँ मैं भाई या तो मैं कल KGF देखने जाऊंगा या RRR देखने जाऊंगा. Please guys, what do you think? I should go and watch RRR or should I watch KGF? I think KGF तो यही Amazon Prime या उसी में आ रही है ना. RRR is on the theaters. I want to go to theaters and get some nice popcorn with a chilled Pepsi, and again my throat will go bad. Exactly. Oh ho, Dr. Sawan heroine. She's saying मेरी आवाज ही पहचान है. Oh, Lata Mangeshkar fan. Very nice. Exactly. Exactly. Perfect. Hmm. Okay, let's. Acha, I wanted to ask a question. The most common congenital heart in Alagille syndrome is pulmonary stenosis. Do we have any other syndrome where the most common congenital heart is pulmonary stenosis? कौन बताएगा? Yes, कोई कौन बताएगा? The most common congenital heart in Alagille syndrome is pulmonary stenosis, and the most common congenital heart in Noonan syndrome. Yes, the most common congenital heart in Noonan syndrome is pulmonary stenosis. Two question, one answer. Two question, one answer. That you should know. Yes, where do you see this vertebra? Butterfly shape vertebra. Very, very beautiful picture. The butterfly shape vertebra undoubtedly we see in Alagille syndrome. Alagille syndrome, that you should know. And what are the various examples of short limb? Yeah, this is a good question. If the limbs are short, guys, nothing but short limb dwarfism. What are the various examples of short limb dwarfism? कौन बताएगा? Exactly. Many people have know this answer. It could be rickets, could be hypothyroidism, could be achondroplasia. Yes or no? Achondroplasia. Yes or no? If okay, if I have a question, मुझे question याद आ गया. Normally, how many fontanellas are there? You know that, ना? We have six fontanella. We have six fontanella. We have anterior fontanella, posterior, a pair of sphenoid and mastoid fontanella. If the posterior fontanella doesn't fuse, delayed closure of the posterior fontanellae, what is the one important thing which I should rule out? It's a very important this one exam question. ये हमने करा हुआ है. It's saying add mnemonic. कौन सा mnemonic dear? हाँ, so if the posterior fontanelle, yes, Shivam Singh Chauhan is very right. If delayed closure of the posterior fontanellae, you must rule out congenital hypothyroidism. So congenital hypothyroidism should always be ruled out. Yes, Osama Sheikh is right if there is a delayed closure of the posterior fontanelle. The various examples of short limb dwarfism are rickets, achondroplasia, growth hormone deficiency, congenital adrenal hyperplasia, and hypothyroidism. These all are the causes of short limb dwarfism that you should know. Done. Yeah, very, very nice picture. Can we appreciate this? Can we appreciate this? This nothing but this is the what do you call this? Is a short trunk. Can we see that short trunk? And this one is a short limb. Can we appreciate this one? This one is short trunk. Can we photographic memory? Okay, एक में trunk छोटा है, एक में limb छोटे हैं. इसके limb बड़े हैं. Here the limbs are very tall. Okay, but short trunk dwarfism and short limb dwarfism. That's what. So various examples we have done of this short trunk and short this one. Yeah, these all we have done. So the examples of short limb rickets, hypothyroidism, achondroplasia. The other varieties of achondroplasia are pseudochondroplasia and hypochondroplasia. Pseudochondroplasia and hypochondroplasia. Parul Verma says, "Hi sir, how are you? I'm good, dear. I'm very good. Thank you so much. How are you? आप कैसे हो, Parul?" So, and what are the examples of short trunk? Obviously, we have told about. So, extra points are Marfan syndrome. Please update in your notes Marfan syndrome, and very importantly mucopolysaccharidosis. I'm going to take a class very soon on IEMs also, inborn errors of metabolism. वो एक topic रह गया हमारा. Yes, so that's what. So the important examples of short trunk other than kyphoscoliosis, hemivertebrae, Alagille syndrome, spondyloepiphyseal dysplasias, we have mucopolysaccharidosis, MPS, mucopolysaccharidosis, and Marfan syndrome. Mucopolysaccharidosis and Marfan syndrome are the important example of short trunk that you should know. Okay, so what is the best answer, my dear friends? Yes, yes, yes. A, B, C, D. पारुल से मैं ठीक हूँ, आपकी तबीयत कैसी है? अब बहुत बेटर है पहले से. मेरा गला खराब हो गया था, ज़्यादा ही गला खराब हो गया था. रिट्स इज सेइंग सर आपका टैटू कौन से वाला टैटू? क्या आप इस टैटू की बात कर रही हैं जिसमें लॉर्ड बुद्धा है, या फिर आप इस टैटू की बात कर रही हैं जिसमें हमारा ओम बना हुआ है, या फिर दो टैटू पीछे हैं उसकी बात कर रही हैं, या मैं अभी बनवाने वाला हूँ नीचे पैरों में एक और, या उसकी बात कर रही हैं? कौन सी कर रही हैं? Perfect. Yes. The topic is coming to an end. Let's cover some tough questions. Bone age, can anyone tell me? Yes, bone age is equal to chronological age. In which condition you will have the bone age equal to chronological age? फॉर एग्जाम्पल यू गॉट माई एक्सरे डन, तुमने मेरा एक्सरे कराया नॉर्मली, अब एक्सरे पे भी आ जाओ एग्जैक्टली। यस पारुल से सर आपके स्टडी करने का तरीका बेस्ट है। थैंक यू डियर, थैंक यू। आई एम ट्राइंग टू टीच एज अमेजिंगली एज पॉसिबल। इंडिया को हम इस पूरे प्लेटफॉर्म को एक अलग लेवल पे लेके जाएंगे जहाँ पे हम बहुत ही खूबसूरत तरीके से सब कुछ रिवाइज कर सकते हैं बिना माइंड को स्ट्रेस दिए। वही ही मेरा मोटिव है। ओके, yes, the most important cause where the bone age is more than the chronological age is nothing but familial short stature. This is a star mark, star mark, star mark. So important question. Bone age is equal to chronological age. Like I would like to ask here some important questions. Bone age. So how many carpal bones do we have here? Osama, how many carpal bones do we have? Lateral to medial, the carpal bones are. She looks too pretty. Try to catch her. Yes or no? Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, and capitate and hamate. Yes or no? Total 8 are there. So again, PG entrance question number 1. Which is the last carpal bone? Which is the last carpal bone to appear in a baby? आखिरी वाली carpal bone कौन सी आती है ओसामा? वेरी गुड, वेरी गुड, वेरी गुड, एग्जैक्टली। पारुल कह रही है सर कम्युनिटी ऑफ मेडिसिन का क्लास अनअकैडमी में लगाते हैं क्या? हम कम्युनिटी मेडिसिन के वी हैव फैकल्टीज, बट पीडियाट्रिक्स ही पढ़ाता हूँ मैं बस। पीड्स के अलावा और कुछ नहीं पढ़ाऊंगा मैं, ओनली पीडियाट्रिक्स। एग्जैक्टली। So the best answer for this question, the last carpal bone to appear is the pisiform, which is the first carpal bone to appear in the baby. Everyone knows about it. छोटी सबसे पहली हड्डी, द फर्स्ट कार्पल बोन टू अपीयर इन अ बेबी इज द कैपिटेट विच कम्स बाय 2 months. The second carpal bone to appear in a baby is the hamate which comes by 3 months. Leave the pisiform aside, leave the pisiform aside, which is the last one to come. By 3 years of life, anyone, by 3 years of life, which carpal bone should come in the baby? So by 3 years of life, very importantly, triquetral should come by 3 years. So remember, by 3 years we will have 3 carpal bones. 3 साल के बच्चे में 3 carpal bones होती हैं. That is the capitate, that is the hamate, and that is the triquetral. So 3 साल के बच्चे में 3 carpal bone होती हैं. 4-year-old baby will have 4 carpal bones. 5-year-old baby will have 5 carpal bones. 6-year-old baby will have 6 carpal bones. So 3, 3, 4, 4, 5, 5, 6, 6. Like that you should know. Like that you should know. Okay. यस वेरी गुड। एंड सो ल्यूनेट कब आएगा? अराउंड 4 years। स्केफॉइड कब आएगा? अराउंड 5 years। आर यू अंडरस्टैंडिंग? मोती की तरह, मोती की तरह आपके बिल्कुल कंसेप्ट फर्स्ट क्लास होने चाहिए, बता रहा हूँ मैं। हम रहे ना रहे लेकिन तुम्हारे कंसेप्ट हमेशा रहने चाहिए, याद रखना, ठीक है? दैट यू शुड नो। सो दैट्स व्हाट। सो बोन एज इज इक्वल टू chronological age by seen in familial short stature number 1, and bone age is more than the chronological age, where bone age is more than the chronological age. Like for example, I am a 3-year-old. I am a 3-year-old. Normally I should have 3 carpal bones. I am a 3-year-old. A 3-year-old should have 3 carpal bones, right? Capitate, hamate, and the other one. But I am having 6 carpal bones. I am having 6 carpal bones. That means my bone age is more than my chronological age, right? What do you think? Yes or no? Exactly. Yes, so bone age is more than the chronological age. It is seen in Beckwith-Wiedemann syndrome and precocious puberty. Beckwith-Wiedemann syndrome and precocious puberty, you will have the bone age is more than the chronological age. That is the first point. And very, very important, where the bone age is less than the chronological age. Again, I am a 3-year-old. Normally, a 3-year-old should have 3 carpal bones, but I'm having 0 carpal bone. I'm not having any carpal bone. That means what? I'm having anemia. No, I'm having malnutrition. Is it so difficult to remember? Everything hypo, like anemia, malnutrition, hypothyroidism, hypopituitarism, all these are the causes for the hypo, where the bone age is less. Bone age is less than the chronological age, and bone age is more than the chronological age. Precocious puberty, Beckwith-Wiedemann syndrome, bone age is equal to the chronological age. Familial short stature. The most common cause of short stature is CDGP, constitutional delay in growth and puberty. Okay, I'm gonna show you a video now. Can you please tell me exactly? अच्छा, मोनी मला सेज वॉच RRR। आज ही बुक करता हूँ, टेंशन ना लो, आज ही बुक करता हूँ, पक्का पक्का बुक करता हूँ। थैंक्स डियर। हाँ, सो कैन यू प्लीज टेल मी व्हाट इज दिस माय डियर फ्रेंड्स? वन ऑफ द वेरी नाइस सिंड्रोम is one of my patient in my first hospital. This patient was there. Number one, what do you call this? क्या बोलते हैं इसको? ये क्या है? I don't know what is this. What is this distance between the two bones? कौन बताएगा इसके बारे में? सावन सिंह। Exactly. This is a typical case of achondroplasia. This is a beautiful case I saw basically of achondroplasia. It's nothing but short limb dwarfism. Can we see that? Yes or no? सर्दियों में आया था ये पेशेंट हमारे पास और मेरे घर के पास ही रहता है ये, मतलब थोड़ा दूर करोलबाग की साइड पे रहता है, मैंने उसको सड़क पे भी देखा था एक बार. आई सॉ हिम ऑन द वे आल्सो दिस पेशेंट. So can we appreciate this? Number one, the patient having genu varum. Remember a rum bottle. Can we remember a rum bottle in between? Var rum bottle, rum. Exactly. So number one, you will see this baby came 2 years back also. See this baby. 2 years back also this baby had come. Can we appreciate this beautiful, beautiful picture of achondroplasia? This baby is having achondroplasia. This baby is having what you call genu varum. This baby is having short limb dwarfism. And what is the gene mutation is you see in this one? Yes, the gene mutation you see in this one is nothing but FGFR, yeah, exactly, FGFR3 gene mutation, and FGFR2 gene mutation. Where do you see? And FGFR1, exactly. So FGFR2 gene mutation you will see in Cruzen syndrome. FGFR2 gene mutation you see in Cruzen syndrome, and FGFR1 gene mutation you see in Pfeiffer syndrome. FGFR1 gene mutation you will see in Pfeiffer syndrome. FGFR3 gene mutation you will see in achondroplasia, and FGFR2 gene mutation you will see in Cruzen syndrome. Very, very important. Achondroplasia. Achondroplasia itself is a very big mnemonic. So in general, I'm going to tell you, then this class is over. Achondroplasia. A for autosomal dominant. C for champagne glass pelvis. So important. Where do you see champagne glass pelvis? Achondroplasia. दिखता कैसा है? I would like to show you 1 second. Yeah, very, very important. Can we appreciate this picture? Yes or no, Baba? This is nothing but champagne glass. Every one of you, I want rank one. Every single one of you. Are you listening to me? Exam is very, very near. Finish it off. Do all the subjects and everyday pediatrics थोड़ा खत्म करो. Whatever I'm teaching, no, whatever I'm teaching, just finish it off. लो ओसामा, ये सावन क्या कह रहा है? I want champagne. Have how many of you have tried champagne? Try करिए champagne. Try करिए तुमने champagne. अब और सावन तो फॉरेन से पढ़ के आया, उसने तो पता नहीं क्या क्या ट्राई नहीं किया होगा. Exactly. So can we opposite bottle? Which bottle? That's very funny. Which champagne do you want? This one or this one, sir? So with this, with ice, without ice, sir? Please tell me exactly. Yeah, exactly. सावन ने तो बहुत करी होगी. Exactly. Hmm. Yes, Dr. Happiness says, Sir, I have to complete big subject. हो जाएंगे, dear, हो जाएंगे. Prep next is delayed motor milestones. Yes, exactly. So, most importantly, point number one, let's finish this. Number one, the A for A, autosomal dominant, C for champagne glass pelvis. Imagine you are reading this for the first and last time. Okay, we are reading for the first and last time achondroplasia. आ जाओ अब चलो 2 minute रह गए, then 2 minutes, then the class is over. I have to go to gym. A for autosomal dominant inheritance. C for champagne glass pelvis. Champagne glass pelvis. ठीक है. H for trident hand. Nothing but trident hand. Sir, what is trident hand? This one. Can we appreciate this one? Yes or no? Trishul की the try. Can we see that? Yes. Very importantly, trident hand. So what is the meaning of trident hand, sir? So trident hand, most importantly, is a divergence in the third and fourth finger. It's a divergence in the third and fourth finger, so that the thumb, first two fingers and last two fingers stand out as a separate group. So try. Can you see? Well, एक ऐसे means very important, like thumb and first two finger, last two finger. Can you see this one? See this full picture. Look at the video. Thumb, the first two picture and last two picture. This is a proper thing. Thumb, first two pictures and last two pictures. It looks like separate. So it's a trident hand. Trident hand. There's nothing but very importantly trident hand. Means thumb, then first two pictures and last two fingers separately. That's what. Revise again. A for autosomal dominant. C for champagne glass pelvis. H for hand, trident hand. O for obesity. Achondroplasia. N for neurological problem. D for delayed milestones. R, it is recognized at birth. Achondroplasia. O for bowing of legs. Bowing. G no. Varum. Rum bottle inside the legs. Varum. बाहर convexity हो जाती है. And P for, very importantly, proximal limb shortening. See, we have distal limb shortening. We have proximal limb shortening. We have something known as rhizomelic dwarfism and mesomelic dwarfism. Rhizomelic and mesomelic. But that's super specialty topic. But in general, we have a दिए अभी पिछले हफ्ते last week we had this MBBS exam. External had asked the what you called MBBS student that in achondroplasia, what type of limb shortening do you have? Do you have a distal limb shortening or a proximal limb shortening? The answer is proximal limb shortening. That you should know. L for large head, they will have macrocephaly. S for short stature, and achondroplasia. I for decrease interpedencular distance. Decrease interpedencular distance. Very good. Prep next. Very good. So prep next, your name is Naveen, right? I think you were there in my groups, no? Your name is Naveen, if I'm not wrong. Hmm. What is this picture? How many of you have seen Game of Thrones? RRR और ये सब करे जा रहे हो. Have you seen Game of Thrones? Yes or no? Hmm. This is nothing but Tyrion Lannister. 10 million followers on Instagram, that you should know. Yes, exactly. And FGFR3, right? What is the full form of FGFR3? FGFR का मतलब क्या होता है? Fibroblast growth factor receptor gene. Fibroblast growth factor receptor gene. Fibroblast growth factor receptor gene. Savan says the lady at the right is beautiful. Khaleesi, she's one of my favorite. Khaleesi, she's very good. Yes, fibroblast growth factor receptor gene. This part is over. That finishes the whole segment, I guess. Everything we have done. Champagne glass pelvis we have done. What is this? I'll give you one chocolate. Exactly. What is this? Yes, this is nothing but, very importantly, bullet nose vertebra. There is increase in the disc height. Bullet nose. Can we see the nose? Bullet की तरह है. Can we see the bullet की तरह है? ये very very important. So this is nothing but bullet nose vertebra. Could be a very rare question. Where do you see bullet nose vertebra? Achondroplasia. In achondroplasia, you will see bullet nose vertebra. That you should know. ठीक है? So where they see this, guys? Everyone, hello. Star mark, star mark, star mark. All three PG questions. Where do you see reduced interpedicular distance between the two pedicles, vertebrae? Interpedicular distance, achondroplasia. Scalloping of the vertebral bodies, achondroplasia. And very importantly, spinal cord canal stenosis also you can see in the cases of achondroplasia. So achondroplasia, 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 that you should know. Yes, fish hook vertebra, yes, you can say that exactly. Dr. Happiness says, sir, really wish the topic which we are revising comes in NEET PG this year. So I also wish to, brother, I also wish, I am trying my best to cover every single topic possible, every single topic. बाकी देखो क्या होता है, अच्छा ही होगा, बहुत अच्छा होगा. That's it. So very typical case of short limb dwarfism. Short limb dwarfism. Dr. Happiness says you made us teach in a very nice way. Thank you so much. Thank you so much for hearing those lectures. Okay, I'm nothing without your support. I'm trying to share my knowledge and you guys are liking it. That's beautiful. This is nothing but, can we appreciate this photographic memory? Short limb dwarfism, achondroplasia, that you should know. This part is over. Yes, and what is pseudochondroplasia? Pseudochondroplasia, yes, exactly. I had this patient of, this is a typical case of pseudochondroplasia, guys, exactly. So yes, beautifully, yes, yes, yes. So one is achondroplasia and one is pseudochondroplasia. This is a typical case of pseudochondroplasia. कि सर कैसे पता चलेगा सर, क्या, how will I get to know sir it's a case of pseudochondroplasia? Now very very important, this one so important, please. Let's see, what all do you know? You know achondroplasia, no? Read one, the other is opposite of that. Read one, the other is opposite of that. Do you see skull findings in a case of achondroplasia? Yes, you see macrocephaly, a large skull with small base, a large skull with a small base. Remember that, dear, the large skull with a small base. That is, you see the skull findings in a case of achondroplasia, whereas in pseudochondroplasia you will see normal skull you will see. Number one. Do you see trident hands in achondroplasia? Like this, the thumb is one segment, these two finger one segment, these two finger one segment, like a trident hand. So you see that in achondroplasia, whereas it is normal. No trident hands, dear, no trident trident hands you see in pseudochondroplasia. In achondroplasia, I told you there's a limb shortening, right? Short trunk or short limb? Short limb, na? Symmetric limb shortening is there. Whereas in pseudochondroplasia, there is asymmetric shortening. Asymmetric shortening, very importantly. And achondroplasia, it's a birth defect. You can diagnose even in utero, also in the ultrasound scan. Whereas pseudochondroplasia, it's like kind of a Rett syndrome. The child was perfectly normal. The child was perfectly normal till 3 years of life, and later the baby came with developmental regression and everything. So that you should know. Exactly, yes, exactly. तो कार्टिलेज का हाँ थोड़ा बहुत है कार्टिलेज का, बट ज़्यादा कुछ नहीं है. फाइब्रोब्लास्ट का ही प्रॉब्लम होता है. यस, स्किन टिश्यू, कनेक्टिव टिश्यू का डिसऑर्डर होता है ये. हाँ, you got it right. Can we revise it? In achondro, how will you revise the number one skull? My off the HOD always used to say, either you explain from cephal to caudal or proximal to distal. Cephal to caudal, number one in achondroplasia, large head. Whereas pseudochondroplasia, normal head. Then we most importantly come down our limbs. In achondroplasia, short limb dwarfism. Pseudochondroplasia, normal, like not normal but symmetrical limb shortening in achondro, and asymmetrical limb shortening in pseudochondro. And then come to tummy, ultrasonographically diagnose achondro, pseudochondro, no, that will be normal baby. Okay, that's over. Skull findings I have told you. Trident hand. Trident hand is seen in achondro, not seen in another one. That you should know. Exactly. Hmm. Yes, we should abort. We should abort this case. That's right. That finishes today's class, Dr. Happiness. Thank you so much, everyone, for this amazing, wonderful participation. Very, very important. Now, please be with me till the PG exam. From tomorrow is the 1st March, 1st April. I am changing my timings for the classes. So, what do you think? Which time of the class you guys are comfortable? Like, are you? I'll give you options. The option number one, 7 to 8. Okay. This is the, so 2 hours I have to teach. 2 hours I must teach in a day. Normally I like to teach. So 7 to 8 one slot. Is 7 to 8 comfortable for everyone? I hope it is comfortable for everyone. Yes, Dr. Sawan, हाँ जी. Yes, कार्टिलेज का इसमें होता है, कनेक्टिव टिश्यू का प्रॉब्लम होता है, कनेक्टिव टिश्यू का. 7 to 8 is one timing. We are planning to change the session most importantly, and the other timings also I'll let you know. It's roughly around 8:30 to 9:30 or 8:30 to 9 p.m. class. I'll try to take it. That's exactly after 8. 2 घंटे लेना है मुझे. I have to take 2 hours. So one before 8, one after 8. Okay. Thank you so much everyone for this wonderful participation. Tonight we have a class on vaccine, guys. Are you free tonight? Are you free at 8:30 p.m. today? At 8:30 p.m. same on the Conquer NEET PG YouTube channel. I'm gonna finish all the 100 questions on vaccine. Vaccine. BCG vaccine, live vaccine, killed vaccine. If BCG given if BCG given subcutaneous, what will you do? COVID is which vaccine? So all the questions on vaccine today, 8:30 p.m. class, and today 9:30 p.m. also I am having an audio podcast. I'm having an audio session where we all can talk to each other. You, if you are free user also, you can nicely talk to me. We can sing songs and poems and stories. When can a baby sing songs and poems and stories? By 4 years. 4-year-old baby can sing songs and poems and stories. Thank you so much everyone for this wonderful participation. Remember, key to success, what is the key to success is to focus on the goals, not on the obstacles. Remember, key to success is focus on the goal. Will you clear this exam? Definitely I'll clear. What will you say? Yeah, will you clear this exam? No sir, I don't think so. I have tried sir, let's see sir. So no negativity, only positive, only positive people allowed. Will you be clearing the exam? Yes sir, definitely I'll be clearing the exam. Like that you should be. Exactly. So your NEET partner says I love your podcast on Spotify. Yeah, I'm gonna make more also. Time नहीं मिल रहा मुझे, वरना मैं तो क्या करता हूँ. Okay, exactly. Dr. Happiness says for how much duration the 8:30 class? Today's 8:30 p.m. class will be for 1 hour. It will be from 8:30 to 9:30, and 9:30 p.m. I'm gonna have my audio podcast session on the open house. Okay, so try to join. So see you tonight, 8:30 p.m. Vaccines, top 100 questions, back-to-back revisions. Let's see how much you can answer. Thank you so much everyone for this wonderful participation. Have a wonderful evening ahead. Stay live, stay calm, composed, and rock the exam. You were born to rock. That's all I know.